Kidneys are vital organs that play a crucial role in our body, responsible for filtering blood, removing toxins, regulating blood pressure, and maintaining fluid and electrolyte balance. However, many of us do not pay enough attention to kidney health, and seemingly harmless daily habits can cause serious and irreversible damage to our kidneys. Did you know that small daily choices can accelerate the decline in kidney function? In today's video, we will explore in detail the 8 worst habits that can quickly destroy your kidneys. Be prepared to be surprised, as some of these practices are so common that you probably never imagined they could be so harmful. From inadequate nutrition to self-medication and seemingly harmless vices, we will discuss how each of these habits interferes with the proper functioning of the kidneys. And don't think these problems are rare. Chronic kidney disease affects millions of people worldwide, often without symptoms until it is in an advanced stage. Therefore, it is essential to be aware of these habits and make necessary changes to protect your kidney health. So, if you want to know more about how to avoid these dangers and take better care of your kidneys, stay with us until the end. Leave your like, share this video with those you care about, and subscribe to the channel so you don't miss any health and wellness tips. Habit 1. Excessive salt intake. Salt, also known as sodium chloride, is a common seasoning that enhances the flavor of food and is essential in small amounts for the proper functioning of the body. However, excess salt in the diet is extremely harmful to health, especially for the kidneys. When we consume too much salt, our body retains more water to dilute the sodium in the blood, which increases the volume of circulating blood. This increase in blood volume leads to higher blood pressure, which is one of the main risk factors for kidney disease. High blood pressure caused by excess salt damages the small blood vessels in the kidneys, compromising their ability to filter toxins and waste from the blood. Over time, this overload can lead to kidney failure, a serious condition that may require dialysis or even a kidney transplant. Additionally, uncontrolled high blood pressure can cause damage to other vital organs, such as the heart and brain, increasing the risk of cardiovascular events like heart attacks and strokes. Studies show that a diet high in salt is also associated with a higher risk of kidney stone formation, as excess sodium increases calcium excretion in the urine. To reduce salt intake and protect your kidneys, it is crucial to pay attention to the labels on processed foods, which often contain high amounts of sodium. Habit 2. Indiscriminate use of medications. Many people turn to medications without proper medical guidance, believing they are harmless when used sporadically. However, excessive and uncontrolled consumption of certain medications can cause serious damage to the kidneys. Painkillers, non-steroidal anti-inflammatory drugs, NSAIDs, and some antibiotics are examples of medications that, if used excessively or inappropriately, can compromise renal function. Pain relievers, such as acetaminophen and ibuprofen, are widely used to alleviate headaches, muscle pains, and other painful conditions. However, prolonged use and high doses of these medications can reduce blood flow to the kidneys, impairing their filtration ability and leading to a condition known as analgesic nephropathy. NSAIDs, such as ibuprofen, naproxen, and diclofenac, can also cause inflammation in the kidneys, resulting in a condition called interstitial nephritis. This inflammation can progress to acute or chronic kidney failure if not properly treated. To avoid kidney damage caused by the indiscriminate use of medications, it is always best to consult a doctor before starting any drug treatment, even for over-the-counter medications. Habit 3. Excessive protein intake. Protein is an essential nutrient for the growth and repair of body tissues and is vital for a balanced diet. However, excessive intake of proteins, especially animal sources, can overload the kidneys and lead to serious issues. Let's understand how this happens and why it's important to moderate protein intake to maintain kidney health. When we consume proteins, they are metabolized by the body, resulting in the production of urea and other nitrogenous wastes that the kidneys need to filter and excrete. In high-protein diets, the kidneys are forced to work harder to eliminate these byproducts, which can increase the stress on these organs. Over time, this overload can cause damage to the nephrons, which are the functional units of the kidneys, compromising their filtration capacity and leading to renal failure. To protect your kidneys, it is crucial to find a balance in protein intake. The general recommendation is to consume about 0.8 to 1 gram of protein per kilogram of body weight per day for most people. Habit 4. Dehydration. Water is essential for the proper functioning of all the body systems, and the kidneys are no exception. They rely on a constant flow of water to perform their functions of filtering toxins and waste from the blood, regulating electrolyte balance, and maintaining stable blood pressure. When you do not consume enough water, your kidneys are overburdened, which can lead to a series of serious health problems. Chronic dehydration can cause significant damage to the kidneys. When the body is dehydrated, the volume of blood circulating through the kidneys decreases, reducing their ability to eliminate waste and toxins from the body. This condition can lead to the formation of kidney stones as urine becomes more concentrated, increasing the likelihood of crystal formation that can turn into kidney stones. Moreover, dehydration can cause urinary tract infections, as concentrated urine can irritate the urinary tract and create an environment conducive to bacterial growth. Pay attention to signs of dehydration, such as dry mouth, dark and infrequent urine, fatigue, and dizziness. If you notice these symptoms, immediately increase your fluid intake. Habit 5. Excessive alcohol consumption. Drinking alcohol excessively is a common behavior that many people do not directly associate with kidney health. But the harmful effects of alcohol on the body are profound and significantly impact the kidneys. When you consume large amounts of alcohol, you put enormous pressure on your kidneys, affecting their ability to maintain the balance of fluids and electrolytes in the body and efficiently filter waste. Alcohol acts as a diuretic, meaning it increases urine production and consequently fluid loss. This diuretic effect can lead to dehydration, a state that, as already mentioned, is extremely harmful to the kidneys. Dehydration forces the kidneys to work harder to conserve water, which can result in damage to the nephrons, the functional units of the kidneys. Moreover, dehydration caused by alcohol can lead to the accumulation of toxins in the body, as the kidneys are unable to effectively filter the blood. To protect your kidneys, it is essential to moderate your alcohol consumption. Health guidelines generally recommend that men should not consume more than 2 alcoholic drinks per day, and women no more than 1 drink per day. Habit 6. Excessive sugar consumption. Sugar is present in a wide variety of foods and beverages we consume daily, often without realizing the amount we are ingesting. While it is a quick source of energy, excessive sugar consumption can have devastating effects on kidney health, contributing to a series of problems that can culminate in kidney failure. High sugar intake is directly related to the development of obesity, a condition that significantly increases the risk of kidney disease. When you consume large amounts of sugar, your body stores the excess as fat, leading to weight gain and, eventually, obesity. Obesity, in turn, can cause hypertension and type 2 diabetes, 2 of the main causes of chronic kidney disease. The kidneys of obese individuals are forced to work harder to filter the blood, which can lead to premature wear and permanent damage. To reduce sugar consumption and protect your kidneys, start by reading the labels on food and beverage products. Sugar is often present in products not typically considered sweet, such as salad dressings, bread, and processed foods. Opting for whole and natural foods, such as fruits, vegetables, lean meats, and whole grains, can help reduce sugar intake. Habit 7. Smoking. Smoking is a habit known for its devastating effects on lung and cardiovascular health, but its negative impacts do not stop there. Smoking directly affects the kidneys in several ways, significantly contributing to the development of chronic kidney diseases and other health complications related to kidney function. Smoking harms the kidneys by reducing blood flow to these vital organs. The kidneys depend on a constant supply of blood to properly filter toxins and waste from the body. When you smoke, blood vessels constrict and harden, which decreases the amount of blood reaching the kidneys. This reduced blood flow compromises kidney function, causing long-term damage. Additionally, smoking increases blood pressure, one of the main risk factors for kidney disease. Hypertension damages the small blood vessels in the kidneys, reducing their filtering capacity and eventually leading to kidney failure. To protect your kidneys and improve your overall health, quitting smoking is one of the best decisions you can make. Although quitting smoking can be challenging, the health benefits are immense and begin to manifest quickly after cessation. Habit 8. Excessive caffeine consumption. Caffeine is a stimulating substance found in various drinks and foods, including coffee, tea, sodas, and energy drinks. While moderate caffeine consumption can offer some benefits, such as increased alertness and cognitive performance, excess can be harmful to both kidney and overall health. Let's understand how excessive caffeine affects the kidneys and how we can avoid these damages. Caffeine is a diuretic, meaning it increases urine production. This diuretic effect can lead to dehydration if fluid intake is not adequate. Dehydration forces the kidneys to work harder to conserve water and maintain the body's fluid balance. Over time, this overload can cause damage to the nephrons, the functional units of the kidneys, compromising their ability to filter toxins and waste from the blood. Additionally, chronic dehydration can contribute to the formation of kidney stones, a painful and potentially dangerous condition. To protect your kidneys from the harmful effects of caffeine, it is important to moderate your consumption of this substance. The safe amount of caffeine varies from person to person, but the general recommendation is to limit intake to no more than 400 milligrams per day, equivalent to about 4 cups of coffee. However, individuals with hypertension, pre-existing kidney diseases, or other health conditions should consult a healthcare professional to determine the appropriate amount for their specific case. Maintaining kidney health requires attention to daily habits. If you enjoyed this video, please leave a like, share it with your friends, and subscribe to the channel for more health and wellness tips. See you next time.